as we are talking today about health and peacemaking, women's health in specific, and we're talking with a few of our friends, Norbert, who I've known now for a few years, working on bringing people together through health, but mainly founding Healing Across the Divide, which is working in Israel and Palestine and medical fields, helping different medical organizations and looking at health in general, not just medical, and health in general, and how to support both of the communities, especially disadvantaged communities in both Israel and Palestine. Hello, Norbert.
Good to be here. Thanks so much. It's a joy to see everybody, especially one of our grantees, the leader, Diddy Mymin Kahn, who we'll be hearing from.
Yeah, and Diddy, you are in an organization called, I hope I say it correct, Kuchinate. What is that?
Kuchinate, which means to crochet in Tigrinya, what people speak in Eritrea.
Right. And you're working on asylum seekers, especially women who are living in Tel Aviv. You're working with them and dealing with their economics and psychological situations and so on. By the way, I know Kim wasn't planning to stay, but I know it's something Kim has worked on as well for quite a while before in Tel Aviv. And then later, this is continued to be one of her passions as well. I know, Kim, if you want to say something or you want to remain in the background.
I will remain in the background for the rest of the time. But yeah, I volunteered in the kindergartens in South Tel Aviv for a couple of years, and I did my thesis about South Tel Aviv and how the Israelis reacted to the entrance of the refugees into their neighborhood, and pretty fascinating, and applaud your work, Didi.
Thank you so much, Kim. You should come and visit us.
Definitely will.
Well, we absolutely will, because we will be coming to visit you on our joint trip with Healing Across the Divides that MEJDI Tours will be running. So you are one of our stops, so we'll definitely get to see you. But I wanted to start, Norbert, I want you, this conversation, we start talking about it because of the release of your new book about women's health and peacemaking. Yeah, you're doing right. That's what my publisher tells me. Always have it in your hand and show it to people. But one thing I think important to start with, in addition to, yeah, why did you write the book? Why is this book important? But in specific, I thought, this concept of peacemaking and health. You know, when people think of peacemaking, we often think of negotiations. We often think of people sitting in a room and talking about who's right and who's wrong and how you're going to make a compromise, and that's it. The moment we get out of this diplomacy peacemaking, it's not as connected, or that's how people think of it. They don't see the connection. Health and peacemaking, what does that have to do with it? And other fields as well in peacemaking. And it's a challenge, it feels to me, usually, to get people to understand that peacemaking isn't only negotiations. It goes into every aspect of our life. It's a way of life. So can you explain to us, how did you come to this, writing the book, and what's the role of peacemaking in the health industry, healthcare industry?
Thank you, Aziz, and it's a pleasure to be here. I'm hoping that from Ramallah, one other attendee will be able to speak about one of the chapters, and if not, I'll certainly be able to cover it because I was the co-author. But again, it's a pleasure to be here. And in essence, the reality is all Americans, whether they know it or not, are involved in the Israeli-Palestinian conflict. Israel is the largest recipient of foreign aid from the United States, and Egypt is the second largest recipient, many billions of dollars. And of course, many of you have heard that there was a war in Gaza. It was not the last war, and there's been several before that. And so I've felt, after my first time in the area back in 1967, that I wanted to be engaged, and I've been engaged in a variety of ways. And in essence, to fast forward to 2004, I started an organization called Healing Across the Divides, where it allowed us to be engaged in one of the three ways, which I will define in just a second, that peace building through health can occur. And the mission of Healing Across the Divides is to measurably improve the health of marginalized Israelis and Palestinians through community-based interventions. So how does that relate to peace building? And so there's essentially three ways that health has been tied to peace building, or peace through health, which was a term that started in the 1980s by the World Health Organization and the Pan American Health Organization. And there have been many interventions that have adopted this peace through health motif. So the three ways are as follows. One is what I would call purely humanitarian. There are a number of efforts that are just try to help people, for example, get treatment in an Israeli hospital who might be Palestinian and don't have that treatment available. So that's one aspect of a peace through health approach. I think it has its significant limitations. Of course, I'd be happy to respond to any questions about it. The second is a much more direct political effort. I would divide that into two parts. One is what we now call, and it's in the newspapers, called vaccine diplomacy. And that actually started in the 1980s, where there will be a ceasefire in the war in El Salvador to allow for vaccines to be applied to both sides. And this was negotiated by health professionals and as a way of building trust between both sides. And there's a lot, and I'd be happy to respond to questions. There's a lot more about vaccine diplomacy. There were efforts to address issues of nuclear weapons that involved both physicians and Gorbachev and Reagan, and that resulted in, in fact, a Nobel Peace Prize. So that's a much more direct political engagement. And lastly is the whole idea of working through peace through going from the bottom up. Because as you said, Aziz, we typically think of negotiators coming together and hashing out an agreement. The reality is that agreement can only happen, if it's going to stick, if their population is supportive. And that population is often represented by community-based organizations. And that's exactly where Healing Across the Divides has worked over the last now almost 17 years, which is to say, we work through already existing community-based groups to measurably improve health. We help them both financially and technically. We bring them together, which we haven't been able to do in the last year, with the hope that long-term, some of the leaders, such as Diddy Kahn and other leaders, when you come, hopefully many of you will come on the study tour, which is at the end of September. You'll come to the study tour. You will meet some of these leaders who are simply amazing leaders. My hope is that one or two or three of those community leaders will be tomorrow's political leaders, because the reality is the leaders in both sides today have what we call, to say in a positive way, opportunities for improvement. So we want to work from the bottom up, but at minimum, we want to see health improvement. And we've done that measurably for more than 200,000 individuals working through already existing groups.
Norbert, you have a few people who co-authored the book with you, and some of these are from your grantees in the region. Can you tell us about those co-authors who worked with you, and what was the overall mission goal of writing the book?
So at the end of the day, essentially, to make it simple, it's one of those stories that is happenstance. So one of the individuals who was on a study tour talked with another individual who was one of the technical advisors with one of the grantees. And they said, you have a story to tell here with this book, with the work that you've done over the last 17 years. And to be perfectly honest, they gave me the idea of trying to get a book written. And it allowed me, frankly, to put the whole idea of peace through health into a broader framework that takes into account the competing nationalism in the area. But some of those grantees, for example, I'll just give one example in the West Bank and Gaza. There's a group called, and they propose ideas. Okay, so we put out a call for proposals, and these community-based groups put out ideas. One of the groups that we'll be visiting in Nablus in the West Bank, they had the idea. They were the first women's shelter for domestic abuse in the West Bank. And what they wanted to do is reach out to women before the physical abuse occurred. And so they proposed an effort to address issues of obesity among Palestinian women and to identify as many of those who might be at risk for domestic abuse. And that was what I would call the community intervention. We helped with both funding and with the technical expertise of identifying an intervention that was scientifically valid, evidence-based, as we say, and they've done spectacular work. So they've done some of the most amazing work in the West Bank, both with obesity, and a sister group has worked on issues of diabetes in Nablus. And we'll be seeing those programs when we go on the study tour.
That's awesome. And these are topics that, just for those who maybe don't know, the Israeli, the Palestinian society, for Palestinian society, this is a very sensitive topic, not an easy thing to work on. Dealing with domestic violence is a major problem to talk about, even in the society. I've been just even last week engaged in a few discussions on that and domestic violence, and it's because we're not used to talk about it, I think, as much. It's hard. It's much harder to work on it and to actually start a shelter for women. That's beyond what anybody's imagination of hard work is. And maybe we can go to Diddy, and you also dealing with a topic that is quite controversial in Israel, which is asylum seekers, women asylum seekers, their health condition, their the challenges they go through. So can you tell us what exactly your organization does and what you do to help these women?
Yeah, thanks very much. Hi, I'm the co-director together with an Eritrean nun called Sister Aziza. I've got a picture here of her. So you can see her, there we are, the two of us, if you can see that. And Sister Aziza is Eritrean nun, as I said, and I'm I guess I'm Israeli, Jewish Israeli, and together we've worked together for the last 10 years, started an organization called Kuchinate, which means to crochet in Tigrinya. We crochet baskets. We started off crocheting baskets such as these. That's why it's called Kuchinate. So the whole idea of the organization is that it is an women's empowerment project, psychological, social, and economic empowerment. And unfortunately, in Israel, there are now 29,000 asylum seekers, and the vast majority of them do not have refugee status. The vast majority of them are Eritreans. So, for example, in Europe, about over 85% of Eritreans have refugee status, which affords you health rights, social rights, work permits, etc. Here, Eritreans under 1% have a refugee status. They're not even examined for their refugee status. So in that case, the sort of civil society organizations are very, very important to help the asylum seekers to basically survive. They also are living here in an atmosphere of quite a lot of racism, xenophobia, and it's not easy at all. Also 10 years on, I mean, we started the organization to help women who were victims of torture and human trafficking, who'd come through the Sinai Desert and were in Israel. They had vast amounts of money that were extorted from them, and the organization started in order to help them to rehabilitate in a way that was suitable to their survival needs and psychological needs. But unfortunately, 10 years on, things haven't really changed at all instead of status. But people have been here 10 years and have the normal ups and downs of life, such as a child may be born with a disability, you have a disability, an illness, diabetes, cancer, heart disease, and there's no assistance. And so Kuchinate is a place that tries to sort of fill this gap. A lot of Eritrean women say it's like a home away from home. They call it their family, their home. And if you come to Kuchinate, what you'll smell is the smell of Buna coffee coming through the door. You'll hear the sound of Eritrean music coming out. You'll see a beautiful studio full of many colors of all of our home, wares that we do, which is a lot of, well, I've just got a doll in front of me here, so I can show you dolls and baskets and tablecloths and bags and all kinds of things that we do, sewing and crocheting and weaving and embroidering. It's beautiful. So you'll see that, and you will hear the woman. The reason that we do events and we invite groups here is to actually heal across the divides. We are funded by Healing Across the Divides, and that's what we do, is to try and engender empathy and compassion amongst the Israeli society in particular, but we have a lot of internationals that come here as well and hear the women talk and advocate for themselves. And we provide often sort of, it's very cool. We have sort of Ethiopian Eritrean food. We teach crochet and different kinds of skills that the women know that they teach to others. And there's lots more to tell. You'll have to come
Yeah,
and see.
I actually was wondering, because most of the asylum seekers who come in from Eritrea to Israel are men. And so there are a smaller number of women, and that might sound like maybe they won't have as many challenges, but in my estimation, that means they have more challenges because of that. Can you talk about that imbalance of having such a small number of Eritrean women making it through? And then what does that mean, being such a small number in the midst of many men, and then in a community where they know no one, and can't speak the language and can't, so many challenges that they face?
Mhm. So the women are indeed, I think it's 23% of all asylum seekers are women. And over here we have over 300 women on our books who are the most vulnerable of the asylum seeking women. Those that, need to earn a living in dignity where we are, rather than the sort of typical jobs of asylum seekers, which is vast majority is cleaning. And the challenges that the women have is basically, are multiple challenges. Some of them have got to do with sort of, very difficult domestic situations where things have changed a lot since they were in Eritrea, and you come here, and we had a spout of, unfortunately, a lot of murders of spouses, because there was a whole issue about the men, some of the men not working, the women getting work. And then we have issue, there's a lot of gender issues around. A lot of them have got to do sort of with domestic issues about the woman having to look after the children, to cook, to do everything in the home, as well as having a full-time job, because they can't make ends meet. They're really in a state of survival. So the women have got a lot of pressure on them. It was interesting during Corona at Kuchinate, no one went hungry. No one didn't get a salary. No one was homeless, but a lot of the men were. In fact, 80% of the population was unemployed, but all of the Kuchinate women kept working throughout the entire period. And so it caused quite a lot of tension, actually, because the men needed to stay at home and look after the children, while the women were either doing their handcrafts at home. We've got some super pictures of, the woman teaching the men to sort of use a sewing machine with the kids all over him. But on the whole, if they were coming out and working at Kuchinate or going and doing home visits, taking things, it was very challenging. There's multiple issues and multiple sort of challenges along this area. Mainly it's got to, I'll tell you what the biggest sort of obstacle is, that many of our women are survivors of torture and rape, and it's extremely taboo in the society. Woman is automatically blamed for anything that's happened to her and can be ostracized from the community. So it's kept a secret. Or if time, she sort of becomes brave and does start to talk about it, maybe with a partner that she thinks would be understanding, where years have gone by. We've got at least 4 couples here that have split up once the woman has started to speak about her experiences. So it's all pretty challenging stuff.
So when we come to visit you on the study tour, what kind of engagement we would have? What would we learn? Would we meet any of these women, your partner perhaps, and learn?
Yeah. So you would meet, depending when you came, because Sister Aziza lives on the Mount of Olives. She's not always here in Tel Aviv, but if you came at the time she was here, you would meet her. And I can assure you she's extremely fascinating woman who's lived all over the world, a nun, and she's like the spiritual mother of the community. And she's got a lot of stories to tell. She actually was the first one that documented the stories of the woman who came through the Sinai and started telling the world what had happened. And she won the State Department Prize for Heroes of Our Time. She received a prize from Hillary Clinton. She's a very inspirational person. I'm extremely fortunate to have worked with her for 10 years, and we've got a very unique relationship, actually a very good friendship and working relationship, which is also heals across the divides, if you think about it, from our different sort of very, very different backgrounds. And you'll definitely meet the women, because our women lead the coffee ceremonies and the meetings that we have as much as they can. All the time we're a work in progress, because many of our women don't have school, like maybe 3rd grade, 5th grade, 8th grade, 12th grade, depending. And we've got 8 managers out of all of the women that are here. So we're all the time trying to empower the women to take over, have public speaking, and be able to learn language better so that they can take control. And more, it's just beautiful how they really, really do that. So you definitely will speak to the woman either directly or in translation, but certainly they're the ones who are at the forefront. And especially if you sort of have lessons from them, sort of crochet lessons, for example, then there's opportunity for 2 hours of more of intimate talking, you know, not just in a big group. And of course, you'll have a beautiful coffee ceremony, and we have, along with it, hembasha, which is a beautiful big sort of Eritrean bread, which is given to visitors, and always popcorn aside, and very nice hosting. Our women, beautiful hosts over here. It's always a nice experience. We've always got good feedback.
Awesome. Thank you. Thank you. Norbert, since Haidar has not been able to join us, and joining from the West Bank has always its own challenges, whether internet or crisis that could be happening there, especially if you work in the health field, things can always arise. Can you tell us a little bit about Haidar's contribution and then what he's doing? You are in mute, Norbert.
Haidar is an example of why my wife tells me that I'm the lucky one to have started Healing Across the Divides, because he's truly an amazing man, and amazing to the point that we're friends. I've been to the weddings of 2 of his children. He has now grandchildren, and know them all. And that's from a human perspective. At the end of the day, what you find, for those of you who will be coming on the study tour, and this part is hard to translate, you know, into a book, the fact that we're all human beings. And what you know, you got a little bit of a flavor, just a little bit of the flavor of what an amazing human being Diddy is, and Sister Aziza, you know, is, you know, hopefully you'll meet her on the study tour. But Haidar is a similar amazing human being. And he worked for an organization that was one of the first grantees, was one of the first 3 grantees of Healing Across the Divides in 2004. And that's how I met him. And so the bottom line is they did a wonderful intervention with led by several health professionals in a town called Igna, which is amazingly hard to get to, but you know, as befits the very strangeness, and that's all, you know, that's what one can say about the conflict. Literally, it takes well over an hour to get there from Jerusalem, when in fact it's only about 2 or 3 miles from the Israeli border, and from a different direction, of course. And so they did an intervention with respect to diabetes that was very well received. And as people know, that diabetes, or some of the attendees certainly know, that diabetes and chronic illnesses are an affliction that particularly affects low-income populations. And to address that affliction, one can give medication. I think that's very important. But at the same time, what's just as important is empowerment of the individual, and empowerment through empowering that individual, of the family. And the question is that we know that empowering the individual through the family, working with thousands of diabetics that several of the community-based groups like the Palestine Medical Relief Society that did this intervention that Haidar worked at, can impact the control of diabetes. But the question that Healing Across the Divides asks is, can it lead to people, to diabetics and their families who basically say, well, now I'm an empowered diabetic, can I translate that into more in the way of health rights, more in the way of political rights? And that in fact happened with two of the grantees that we funded in the past, where an Ethiopian Jewish grantee, together with a Palestinian Israeli grantee, filed suit together to access healthcare rights. And that started with an intervention that looked at how to improve diabetes for both of those populations. That's one aspect of who Haidar is. The second aspect of who Haidar is that he comes from a town, a village called Imwas. Unfortunately, it would be much better for you to hear from him, but this is not the first and won't be the last time we'll have difficulty connecting to the West Bank. But you would visit that on the study tour, you would visit this village, which is no more. It is one of the villages that was destroyed by the Israeli army after the 1967 war. And it is now part of the Jewish National Fund. It has become a park. So in one of the mornings that we, of the study tour, we visit with Haidar and we visit the ruins that are still in evidence in this park that is surrounded by these amazing trees. And it's, again, hard to transmit, especially for me, because I did not live through it. But even I think a little challenging for Haidar to do it just by words, but you would see it on the study tour. And the last thing I would say about Haidar, and then I'll stop and see if how you want to pursue it, and is the issue that he is a practicing healthcare professional. And there's a chapter in the book that talks about, that speaks to the issue of Israeli attacks on Palestinian healthcare professionals over the last several decades. And I'll just read to you a heading from the most recent, it was dated May 12th, 2021. And there was a demonstration by Palestinians at the Al-Aqsa Mosque on the day before. And what happened is that Palestinian emergency crews from Jerusalem were blocked and attacked and had their medical equipment confiscated by the Israeli army. So that chapter that Haidar co-authored speaks to the history of the challenges that unfortunately are worldwide and unfortunately have been even exacerbated under the COVID pandemic, where healthcare professionals have been literally killed because, not in the, that has not occurred in the Israeli-Palestinian conflict, but around the world, where several healthcare professionals have been killed because they thought they would be transmitting the virus. So healthcare professionals are under threat, and there's one chapter of the book that Haidar co-authored that deals with the attacks on Palestinian healthcare professionals. That, together with where he came from, together with his amazing work on diabetes and what it means for empowering Palestinians and Israelis, is what he'll bring to bear for those of you especially who will meet him.
Thank you, thank you. And I fully agree, having been to protests, having worked in media before, I think journalists and medics in war zones, conflict zones, usually are two of the most targeted, unfortunately, civilians in events who are not even taking part of any of these. And those protests you were mentioning, my cousin actually was following, reporting on it as a journalist, and was tear gassed, even though she was not part of the protest, not even standing close to the protesters. And that's an unfortunate an awful thing that happens to people in these professions. You'd think they'll be treated much differently. It's not the case. We are starting to get some questions, and I have a question for both of you, Didi and Norbert. So it says, do Norbert and Didi's organizations have a rabbi, between quotation mark, I think maybe means a connection, in the Israeli government who provides support of any nature, even administrative protection against powerful people who doubtlessly feel threatened by these beautiful projects? How do these projects function freely in a society that may see them as inimical to certain policies? So do you have any help internally from government people who are up there making sure your project working? And our policies, or I mean, I can remember an Israeli politician one coming to South Tel Aviv and saying awful things about asylum seekers. And we know, like you mentioned, the policies, only 1%, I think you mentioned, get the asylum seeker registration being seen as refugees. So does that affect your work? And do you have any support in higher places?
Thank you for the question. It's a good question. Well, we don't get any support from the government. In fact, I would go as far as saying I think we support the government, because for a long time they took a deposit law from the asylum seekers and from employers of the asylum seekers, which was 36% of their salary, 20% for the asylum seeker and 16% for the employer. Now they've stopped that for the asylum seeker, thank goodness, but 16% we still pay. In addition, we pay very heavy sort of tax penalties for hiring asylum seekers altogether. So for every, we pay 44% taxes for asylum seekers who are on not very high salaries. So that's number one. Number two, no, we don't. In fact, we've just got a new Minister of the Interior who's responsible for all of these issues. The first thing she had to say when she came in to government was that she was going to deport all the asylum seekers. And I actually don't believe she can do that, because I've spoken to a few lawyer sort of friends of ours in partner organizations, and apparently she probably won't have the power to do that. But it's not a friendly environment to be working in. And when Bibi, our previous prime minister, would come to South Tel Aviv, he would meet up with quite anti-asylum seeking representatives, and that's what he would choose to work with. So in short or in long, no, we don't get any help from the government.
And Didi, just a reminder maybe to people, those who are coming from Eritrea are not just coming for financial gain. Living in Eritrea, especially for young people, can be threatening. Those who end up conscripted to the military could be spending their whole life without a choice of leaving. It's pretty much a slavery situation.
Yeah, it's a police state. They say that it's the North Korea of Africa, Eritrea. It's pretty bad. And so people are escaping, from different, we have quite a lot of different situations, but on the whole, I would say is common is escaping from sort of compulsory military duty for your whole life. It's not like a 2-year stint, a 3-year stint. You're there for life, definitely till 40, till 50. And so people live in poverty, and also it's slave labor, really. That's what it is, the army, because you're not necessarily doing army work. You can be doing all kinds of office work, government work. You just don't get paid for it.
Right.
And you
And
don't
that
you might go
those
home
who have
year,
escaped,
first.
if they are sent back, it's pretty much a death sentence, because they have defied.
They would be in danger. They would be in sort of fear of death or persecution if they went back, and therefore they really, the vast majority of them really are sort of do answer the criteria for refugee status, but they don't have it. In fact, their refugee status claims are not even examined. So it's not a good situation to be in. I'd say 90% of asylum seekers here are claustrophobic. They would like to leave, to go to a place where they can have hope, because there is very little hope here for asylum seekers, because there's no, besides the fact that you don't give refugee status, even if you do, you will never become a citizen. So it's pretty tough. And so they're very worried about their children and the future, and correctly so.
Yeah. Well, thank you. Norbert, how about healing across the divides, how about your connections? I mean, you work across, and we'll go to Gaza a little bit because one of the questions related to that, so let's leave it for now. But you're working in Israel, you're working in the West Bank, you are dealing, like we said earlier, with controversial topics. Do you have to have those connections, or you're fighting against the system as well?
It's a little bit different from us because it goes back to the heart of the theory of change that we have. And I would like to make one comment on Diddy's important statement. But in essence, the grants that we give are 3-year grants. In the second year, as part of working with the community-based groups, we start to encourage the group, the community organization, to engage with their respective government, to try to share with the respective government or with the private sector what they're doing, because the first year is the proof of concept. Second year is to expand from the proof of concept and start to tell an entity that might be possibly interested in continuing the initiative. And then the third year is continuing the efforts and try to disseminate the effort. And so what's happened is that, in essence, in Israel, which is a first world country, several of the initiatives have been continued and either have been taken over by the private sector, the private healthcare sector, or even by the government. So that has happened. In the Palestinian side, it's much more difficult because at the end of the day, just like you saw from the difficulty of Haider accessing the internet, essentially the West Bank and Gaza are completely donor-based economies. There's no real opportunity for continuing the efforts, but for example, the initiatives that I referred to in Nablus were doing so well and that had good relations with the Ministry of Health, such that during the COVID pandemic, they were helping out the Ministry of Health with getting the word out in terms of the best preventive practices. So that's what we do in our second year, is to try to encourage them, to the community-based groups, to engage with their respective governments, to engage with the private sector, to try to share with them the successes and the challenges that they've had, to try to continue the work in whichever way they can.
Right, let's continue maybe then into the other question, which is, where has been, or have you been involved in the recent war, in what happened in Gaza? Have you had any involvement there, any support there? And then in the maybe recent events happening in the West Bank as well, whether it's Sheikh Jarrah or Al-Aqsa Mosque, which you mentioned earlier, or other areas?
So one of the grantees, so we, Healing Across Divides cannot fund directly into Gaza. So one of the proposals that we received.
Can you explain that when you say
Yes.
you can't fund directly into Gaza?
That's a good point. To the details that I understand it, when I'm just told no, I don't look for details, but to the details that I understand it, that you can't fund directly because of the fact that the government in Gaza is considered to be a terrorist organization and therefore cannot be funded, even indirectly.
And that's by the American laws. If you support things in Gaza and the US government decides whatever you funded is connected to any terrorist connections from their point of view, you could lose your status as an organization and probably end up in jail as well.
Right. And, yes, and my wife would prefer not to visit me in jail. At least that's what she's made clear. Bottom line being is that there's an organization, the diabetes equivalent of the American Diabetes Association. There's one in Palestine called the Palestine Diabetes Association that covers the West Bank and Gaza. And there's an initiative that works with diabetes experts that is doing the work that was developed at Stanford and translated and validated in Arabic, that essentially is an empowerment program pertaining to diabetes, okay? And there's a webinar on our website where you would hear a most amazing, for example, one of the leaders of these teams, who's a medical student in Gaza, who speaks English quite amazingly, and You'd certainly meet him, not directly, but you'd certainly meet him through video when we were in East Jerusalem on the study tour. But the bottom line is that that group of type 1 diabetics had very significantly decreased access to life-saving supplies during the war. And so as a consequence, we did an emergency campaign that was quite successful. We raised about $10,000 that went directly to supplies for these teenage diabetics. Don't forget, insulin has to be refrigerated. A little known fact is that there's very little electricity, just a few hours a day that is available to people who live in Gaza. So that's all a challenge. So that's how we were involved in Gaza, which was, of course, the most directly impacted. And we had several meetings. We have a representative in Israel, a representative in the West Bank. Our representative in the West Bank had very close working relations, clearly, with all the grantees, and to help them in any which way they would like. I would just like to highlight two things. So I started out, this book talks about, peace building through women's health, and it deals with the Israeli-Palestinian conflict. But African refugee asylum seekers are not directly engaged with the Israeli-Palestinian conflict. But Healing Across the Divides has always and will always supported, for a good number of years, and hopefully it will end when the last African refugee asylum seeker is able to leave. We will support the efforts of organizations like Diddy's because of the fact that, in fact, they are extremely discriminated against, as Diddy has already highlighted. And I myself am and a number of us, we have both Jewish Americans, Muslim Americans, and Christian Americans on the board. I myself am a Jewish American, child of Holocaust survivors. I'm very sensitive, frankly, to the issues that are highlighted by the African refugee asylum seekers. And I just want to point out that Diddy is having a crowdfunding campaign that I would just encourage you, Diddy, to put the information in the chat box, because we, Healing Across Divides, we exist on individual donations largely. Remember, our mission is to empower and to support community-based groups like Diddy's. And I just want to highlight the amazing work that she's done, and we want to make them as successful as possible, both with funding and with the work that we did on the storytelling, which is an amazing work that they've done to track storytelling from the beginning of the interventions that they've been tracking to show some of the wonderful work that they're doing.
That's awesome. Well, do you create or the grantees you have, do they get to network with each other, learn from each other, meet each other, and also across the divides, meaning Israelis and Palestinians learn best practices? I'm not talking about dialogue, I'm not talking about normalization, but I'm talking about actually really understand how they can support each other when it comes to healthcare.
So until 2019, we, unfortunately, Didi has not been able to, because she's a relatively recent grantee. Until 2019, the grantees, both Palestinian and Israeli, the vast majority of them got together in East Jerusalem. In the last half of 2019, the Israeli military would not allow Palestinian grantees to come to East Jerusalem anymore, and that has stopped. They always, the grantees never wanted any publicity about this because, frankly, the Israeli grantees, especially the Jewish ones, were being harassed by other Israeli Jews, and Palestinian grantees were being harassed by Palestinians. So these were always under the table where we would spend the entire day together, and people would exchange ideas on some of the programs. And just two very quick vignettes. One of the initiatives that we support is a farm. And I mean, and I have no knowledge about farms at all, but this is a farm of Israeli Jews and Israeli Bedouin in the southern Israel. And the outcomes that they're looking at is improved nutrition and improved communication. And one of the women who came to one of those grantee meetings So she came from southern Israel, just came up to me after the meeting and said, you know, it's amazing. I live 2 hours away from Nablus, and this woman from Nablus is doing work very similar to the work that I'm doing. We had a whole exchange of ideas, but I never would have met her if it wasn't for this opportunity. And so what we're trying to do, yes, we're not doing negotiations. What we're trying to do is build the seeds of some aspect of trust between leaders on both sides, hoping that some of those leaders will be tomorrow's political leaders, but in the meantime, we will have improved nutrition and improved communication as we have done. Second vignette is one of the Palestinians had to leave all of a sudden in one of the day-long sessions. And I asked him, well, what's going on that you have to leave right away? He said he needs to help out several families because one of the families is having their home demolished by the Israeli army, and he wants to try to work with the families to as much as possible to avoid any violence. And this was going on in East Jerusalem. So he left right in the middle. And that's, of course, I want to be clear, I did not witness a home demolition, but it's still painful for all of us to hear that type of story when in fact it continues and it still continues. But those are the kind of gatherings that we have. The Palestinian grantees do still get together, and the Israeli grantees are going to start getting together later this year. And hopefully maybe in 2022, the Israeli and Palestinian grantees will get together again, but not physically. And the challenge is the fact that there's less and less trust between Palestinian and Israeli grantees, especially on the Jewish side in Israel.
Yeah, and let's hope on the study tour we can get some of those grantees together over a dinner on both Israeli Palestinian side. Didi can come and meet some grantees she hasn't maybe yet met. But talking about house demolitions, for those who are not following the news, today is actually a major day for that because today almost 80 plus 88 houses in Silwan are supposed to be demolished. And so we all watching to happen what's gonna happen there. The houses are supposed to be demolished. So a national park, biblical park is supposed to be built instead. Silwan is it's a 5 minutes walk down from Al-Aqsa Mosque, the walls of Jerusalem. So that's something for those who are here, this is something you wanna watch. House demolition is a major problem in Jerusalem. And so with all, I mean, some of what you do is very uplifting. Some of what you do is really encouraging, even though you are dealing with hard hitting issues. And I'm thinking, we talk about the trip we are running together, and I'm thinking about some people might be listening saying, so are we going to be talking about health 100% of the time? Is this only for health professionals, for somebody who's really interested in those topics? And I want to make it clear, and Norbert and Didi, you can add that that's not the case. While we will visit those grantees and hear their stories. You are mainly listening to stories of people having access that very few people can get access to with these organizations, internal knowledge that people don't. But we're still doing sightseeing, we're still learning, we're still gonna visit places. When we are in Jerusalem, we'll go to the Old City, we'll go to the Western Wall, to the Aqsa Mosque, to the Holy Sepulchre Church. So we're still gonna see the things that you will, or some of the things you will see on other classic tours.
And eat amazing food.
And that's very important because of having all these connections. You eating with people and not just eating at touristy restaurants, which we try our best to avoid just the touristy grade of food. So you are absolutely right. Good food, good connections, good you're making good friends. And so I don't want people hearing this to think, oh, this must be a rough trip. I'm just going to be hearing about horrible things and what you're doing about. It's a mix of education, learning, connecting, but also a mix of some fun and understanding and enjoying your time. We understand you can't only 100% of your time be learning, in the sense of learning about what's happening and the issues and solutions. So
So two things on that. Number one, when you meet some of these community-based leaders, the reality is they can't be doing this 100% of the time either. They're fun-loving. They're amazing leaders, but the reality is that they have to have some balance in their life. So we all have to have that balance in the life. The reason at the end of the day why we are affiliated, and we're so lucky to be affiliated with MEJDI Tours, is that they have a dual narrative tour of an Israeli guide and a Palestinian guide, neither of whom are healthcare professionals. In fact, I think that both guides are very intrigued when we visit some of these grantees. But you'll hear and you'll participate in debates between themselves and between yourselves and the guides, and discussions. And so those kind of discussions that will occur both with the two guides who are part of the MEJDI tour effort, will be complemented by, for example, people like Diddy, people like Haider Abu Ghosh, who unfortunately, couldn't get connected today. But it's that kind of engagement, but it'll be complemented by not just having fun, but I would like to emphasize, as somebody, I was born in Italy, so I really very much appreciate good food. The food that the MEJDI Tour people expose us to is nothing short of spectacular.
Thank you. We actually, just for those who interested in travel, we just had our first tour since the pandemic in the region, and it was amazing to have people back on the ground and just be able to visit. What we decided, because in the beginning we were told West Bank was off limits, however, it's not anymore. We just received that, but we were able to deal with issues, going to Lud, for example, and Ramle, and see the joint city there and talk about the recent violence there, and go to Jaffa and go to Akka, Akko, and get to hear from people from these communities, but also get to meet with amazing minorities that normally, honestly, we didn't have time to meet with, because just the trip is so felt like the Circassian community in Israel. And so it ended up being just this amazing trip. And I'm saying this just to say it's exciting for somebody who's working in travel to see people traveling again, having fun, enjoying, but also getting a lot of different perspectives. They had two different tour guides, a Palestinian from Akka and Akko, and an Israeli from Jerusalem. And so it just was incredible for us to see that happening. I want to give you, we are getting to the end of our hour. So I want to just, Didi and Norbert, give you the last word if you want to add anything. Didi, I reposted your campaign because you sent it to panelists, so I sent it to the attendees as well. But feel free if you want to say anything else. It's the floor is yours.
Just want to say that we look forward to seeing some of you in Israel when you come, and I can assure that at Kuchinate, at least, you will have a very interesting and culturally enriched experience meeting with the African asylum seekers here. So we really do hope that you will come, and we look forward to meeting you. And thank you for inviting me to tell you about Kuchinate, and thank you for inviting me to put the link on our page. Actually, we're at the peak of our campaign. We've only got 24 hours, 28 hours left to reach our goal. So every cent counts. If anyone can press on the link and help us, it would be extremely grateful. Thank you so much, and thank you.
Thank you.
And my last words are that there are two people who specifically I could not highlight and could not, because they weren't part of the program, but I wanted to really emphasize that the Healing Across the Divides representative, Marganit Ophir Gutler in Israel, and Nihat Fatah in Ramallah, are doing amazing work. They will be on the study tour. They've worked with us for years, and they're the eyes and ears on the ground. They engage with the grantees. Look at all the proposals as they come in. So it's very important for me to really emphasize that we who are in the United States, we're helpful, we're important. We start the organization and together with the board members, some of whom are on the call today. But I want to specifically highlight and explicitly thank both Marganit and Nihad for their amazing contribution to improving the lives of marginalized Israelis and Palestinians. And they themselves are in their own way the future and the leaders that we're hoping for.
Thank you, Norbert. And thank you everyone for joining us this Sunday morning. You have something else to say, Norbert?
Well, there's a last question. Is it still possible to join the study tour? So that's
yeah, absolutely.
And so we have essentially till July 6th for people to join. And on the website, there's information about the study tour. Please feel free to contact myself if you have any questions. As you might imagine, as a very last statement, that not only are MEJDI tours very cognizant of security considerations, but they're very cognizant of any issues pertaining to the COVID pandemic.
Right, and I added Shannon's email for anyone who's interested. mejditours.com is our website, so I added both of those on the chat. Feel free to check it out. And yes, absolutely, the trip is still available, and we'll be excited to have you join us on this trip. And
thanks to MEJDI, and thanks to Diddy.
And I like to always end our conversation that it's not where we travel to that matters, it is how we travel. And I think this was an example of how travel does make change. I got to meet you, Norbert, through travel and got to know you and many of the grantees. And that's what's transformational about those kind of trips. It's you can go to Israel, you can go to Palestine and leave, not meet any of the amazing people you work with, or you can go and just make so many new friendships and learn about this amazing projects happening as you are traveling through the country. So thank you so much, everyone, and have a great rest of your Sunday, and see you soon.